Therapeutic procedure, Chapter 17 in the fundamentals class. Let's go. A lot of this is going to be review, which is great for you. Therapeutic procedure. This would include an assessment, planning, performance, and evaluation. The assessment would be for you to review any information and understand any present conditions. So this would be with the intake form, the consultation where you gather your information. Planning. Once your information is gained from the assessment, it's used to set treatment goals or strategies and therapeutic techniques to address specific conditions. So most of this planning is going to be done right after the assessment, right before your massage, to try to find the right goals that you're looking for and that your client is seeking. The performance aspect of this would be your application of your techniques. This is the hands-on part. Evaluation, the outcome of the session regarding effectiveness and selected procedure. So this is where you would decide, did this work? Do I need to do something different next session? And just kind of talk with your client. You might see them next session and they said, it helped for a day and then the pain came back. So you might want to try to do something different. Documentation, as we are all familiar, all info must be carefully documented using our SOAP notes. So again, SOAP notes, you'd have your subjective, objective, assessment and application, and plan. If you are doing massage for relaxation only purposes, this tends to require less thorough documentation. A lot of it would be subjective. Client has no complaints, just wants to relax. Objective would be here you can put the duration if you'd like, or you can put the duration in A. I tend to like to put this in objective. So here I'd put 60-minute relaxation massage, medium pressure, whatnot. Assessment and application. Client left relaxed, no other complaints, something like that. Plan, presume massage as needed is an easy one. So it'd be a very quick, very a lot less thorough documentation. Intake procedure. Setting the appointment may include screening to determine their primary reason for their visit or why they're seeking treatment. And this is also where the client might give you their complaints. A lot of times people will call you or text you or book online and say that maybe they have neck and shoulder problems or they're having stiffness in their upper back, something like that. Then you have your initial greeting and your consult, so your consultation. This is where they would fill out intake forms. I like to have them do them ahead of time, so if there is an issue that's a contraindication, they're not surprised the day of their visit, and we can have them fix the problem or heal from the problem and then seek the massage when they're healthy again. This is where you would state any of your business policies or procedures. So your treatment plan would be where you create a plan for a visit based on their chief complaints or the reason for their visit. Then we have our informed consent. Remember, you can add this to your intake form. This is the form that your client must sign for you to document before proceeding. So this would be your intake form, and maybe it would say something along the lines of, for the client, I have filled this out to the best of my abilities, with honesty, blah, 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 blah. I know that my therapist cannot diagnose or cure me of disease, something like that. And then they would sign it, date it, and then you have that in their files in case, things get a little messy and they could try to sue you saying that you claimed that the one massage would fix all their problems or something silly. Identifying practice assessment techniques. So, common assessment protocols would include your client medical history, a close observation. So, this is, when you're looking at them, observing their body. And under that would fall your posture assessment, your gait assessment, watching them walk. Pain assessment, you can tell them to rate their pain on a scale of 1 to 10. 1 being very little, 10 being excruciating. I need to go to the ER pain. This is where any number of functional or orthopedic assessments could be included if you want to do range of motion assessments and whatnot. Or you can palpate certain suspected structures. Even before they get on the table, you can kind of palpate. It just really depends on the kind of therapist you are and the timing and the clients that you have and what they're comfortable with. Use your observation as an assessment tool. So this would start with your visual observation. Excuse me. Look for structural alignment and balance issues just by looking at them or looking at them while they're on the table. Constantly be looking for those alignment problems. There could be bilateral discrepancies and variations of skin color. So it could just not be structural. So maybe there's one side has more heat. Red would be inflammation, integrity. Maybe you're noticing one side is a little more taut and the other is a little more supple. So constantly look for bilateral discrepancies. Posture observation. Look for spinal curves, deviations in the coronal or sagittal planes. So you're looking at the different plane types. Look for, that's supposed to say elevation, not elation. Look for elevation and rotation of body landmarks. No boy landmarks. Sorry about the typos here. Look for symmetry. Look at skin folds. Skin folds will tell you a lot about symmetry. You might notice that when someone is prone or laying face down on their lower back, maybe one of the skin folds is a little bit higher or more prominent and the other is, lack thereof. Gait assessment. Observe the manner in which a person walks. So this would start in the beginning because they're not walking while they're on your table. Look for variations in how the feet come in contact with the ground, balance of the torsos and hips, how they might shift their pelvis or swing their arms. All this is a pretty important tool to look at when assessing. And last, there's the range of motion. Look for restrictions in joint range of motion. You can either have your clients actively go through the range of motion. You can passively go through the range of motion with a joint, or have them assist. So this is when you both put that joint in the range that you want it to. Maybe internal or external rotation, flexion, extension, whatnot. The big one here you guys haven't learned yet is many discrepancies in the body are caused by agonist and antagonist imbalances. So this would be, I like to use the example of quads and hamstrings. Say your quads are doing the work of straightening your knee. Your quads would be your antagonist, and the back of your legs, your hamstrings, would be the antagonist. So sometimes one side might be weakened or tightened. It's going to affect that antagonist side. Postural assessment. So here's a cool little picture of somebody standing, and you have the graph on the image so that you can kind of see the alignment a little bit better. I'm not going to go over the main details on the left here, but I just want to look at the pictures. If you're looking on the first picture head on, you're noticing that her left shoulder seems up a little bit higher. It's elevated. Her right shoulder looks like it's dropped down a little bit. And I'm also going to look at where her hand lies and her fingertips. Again, this is actually kind of crazy, but the side that's elevated, her fingertips are actually kind of lower. So that is going to tell me that maybe her arm is being pulled back a little bit. We're also going to look at the head to see if there is any rotation, any deviations there. We're going to look at the hips, and we're going to look at the ankles. So all that plays a part in your postural assessment. It does if we look at the picture to the right. So the green line is supposed to be what is common, what you want the posture to look like. The red line is where her posture is. So if we're looking at the picture of her from the lateral view, her head is kind of pushed a little bit to the posterior, or sorry, the anterior side. So it's got a little anterior tilt or a little flexion in it. And also it looks like her hips are kind of pushed forward just a little bit as well. So all that will kind of give you an idea of what to work on. Obviously, we want to bring that neck back a little bit. Maybe those anterior neck muscles and the chest muscles are pulling her head forward a little bit. And we might want to address the low back and the glutes to kind of soften that tissue to kind of bring the hip back. Assessing range of motion. So we have different kinds of tissue that we're going to feel for. Your contractile tissue is fibrous tissues that have tension placed on them during muscular contractions. So if you look at the word contractile, think of contract. So those are the muscles that can contract. Or the tissues, that can contract. So this would be your muscle tissues, tendons, muscle attachments. Then we have something called inert tissues. Inert tissues are not contractile. These tissues cannot contract. They don't shorten and lengthen. This would be bones, ligaments, bursa, blood vessels, nerves, cartilage, etc. Your end feel, remember that's with the range of motion. This is the change in quality of the movement as the end of a movement is achieved. So you'll feel that end feel where the body wants to stop, and there's different end feels. There's a hard end feel, the soft end feel. We've gone over this already, but you want to feel, it'll be a little more natural as you progress with palpation and working on people. You'll be able to feel that end feel a little bit better. But if you aren't sure and you're doing range of motion and stretching with a client, ask them how it feels. They might feel that stretch far before you get that end feel. So you might want to stop the stretch at a more comfortable position for your client. Then we have capsular patterns. So this refers to the proportional limitation of any joint within that capsule that is controlled by a muscular contraction. So, our muscles cross joints, and that's how we move our body. And sometimes those capsules can have a dysfunction. So we're going to be looking for that within the range of motion. We're also going to be looking for shape and temperature to see if anything feels or looks a little off. So we want to recognize soft tissue barriers. So we have our resistive barrier, which they call the pathological barrier, our physiological barrier, and our anatomical barrier. So our resistive barrier or our pathological barrier is the first sign of resistance when tissue is moved through the range of motion. So that is your physical barrier in a way. Your physiologic barrier is as far as the client can comfortably move the joint. So maybe this is why I'm saying we have to communicate. There, you might have a different end feel than what they can handle. So this is where they can comfortably move the joint, either just because of issues of flexibility or, recent injuries or surgeries. Then you have your anatomic barrier. This is past the physiological barrier where the tissue stretched to its maximum capacity without injury. We're not pushing past their anatomic barrier. Now remember, healthy tissue should exhibit zero pain, no pain when moving it through range of motion. All right, let's differentiate between acute and chronic conditions. Acute refers to a condition with a sudden onset. It's relatively a short duration. This would be your muscle strain or your muscle sprain. Typically, um, with assistance or medical assistance, these things can heal on their own within a couple weeks, or even like a month or two, right? Um, your chronic condition would refer to a lingering or ongoing condition. Usually, this is months long, years long, and that is what you would consider chronic. When a tissue is injured, there's a release of histamines to that area that causes a local vasodilation. This increases the swelling, the heat, and the tenderness to the injury site. Man, we're having all kinds of typos on this uh, presentation. I apologize. It's not supposed to say heart, it's supposed to say heat. So remember, inflamed tissue is warm to the touch, it's swollen, and it's tender typically. Massage may be a contraindication if the injury is in the acute stage, so that can last 2 to 4 days typically. When we're using assessment information to plan sessions, these are the components that we might include. Referral from another healthcare professional for further assessment. Referral to another healthcare professional for treatment instead of or alongside massage. So just because we tell them to go to the orthopedic doctor doesn't mean we're still not going to massage them. It might be, both of us tag teaming this client to get them to their best as soon as possible. The initial number and frequency of the session to be given. So typically, if we're dealing with, this acute injury, even a chronic injury, we might want to set a number of sessions and frequency, or how long each session is or how often they should come for optimal results. If I'm dealing with somebody like this, it's usually I tell them come a half hour once a week if they can afford it or timing reasons, or every other week. They can even do an hour, but if we're just working on a specific area, you don't need a 90-minute massage unless they want the full body done as well. Right, the estimated length of the treatment and whether they're a full body or specific to the condition. So I just kind of went over that. That is up to you and your client. They might want a longer session because they want to get everything worked on, but also it is good to work on everything because remember, everything is connected. So you guys can use your best judgment and find the best treatment plan. Maybe you want to do a longer session and then in a week or two do just a spot session, and then in a week or two again do that longer session. And then as they start feeling a little bit better, you can start spacing those appointments out. So they don't always have to come in every week or every other week. Once they start feeling a little bit better, or the massage is lasting longer, you can, push that out a little bit longer. You might want to use different modalities such as heat or ice or hydrotherapy to achieve your goal quicker. You might also suggest your client uses, the heat or ice at home. I a lot of times tell people to do contrast therapy and with ice. So do your heat for 15 minutes, let your body get back to natural temperature, and then ice. You can alternate back and forth throughout the day. This is where you might want to decide which massage techniques will be used or avoided. The areas of the body you might want to address or avoid. Recommendations for home self-care and which results are expected and when. So, ask your client what their goals are. Tell them what goals might be achievable and what might not be. If you communicate well, they will trust you better. So we have hypertonic and hypotonic muscles. Hypertonic refers to increased muscle tone. This is muscles that are too tight, too bound. So think of somebody who's hyper, they're just too much sometimes, and too wound. So that would be your hypertonic. The opposite is hypotonic. This is your decreased muscle tone, where the muscle might be too lax, too loose. When a muscle's constricted or overactive, in the hypertonic stage, It is common for the antagonist to be hypotonic or weak. So here's my example. Tight quads mean a weak hamstring. So typically, for best results, if you are working with somebody, you might want to suggest they seek an athletic trainer, or just, go on their own and look for exercises on YouTube maybe that might help strengthen the weak areas. But so remember, if one side's hypertonic, the other side, the antagonist, is typically going to be hypotonic. It's very common. And that's it. All right. Till next time.